Your doctor will tell you which molecular study might be suitable for you and if it's open for recruitment in your cancer hospital. Focus4 N is the only study that's always available for all patients to consider, irrespective of their gene test results. It's a randomised controlled trial comparing active monitoring with an oral chemotherapy drug called capecitabine. Let's hear the doctors explain a little more about it.
In the situation where we can't identify an abnormality within the genes because the test has not worked or the sample has not been of good enough quality through no fault of the individual, then there is a trial within Focus4 called Focus4 N, which is appropriate for those individuals. The other side of that is some patients may elect to go into Focus4 N. So even if an abnormality is found, then patients can choose to go into that trial. And that trial is looking at the use of active monitoring, which we would consider a relative standard of care at the moment, versus actually continuing somebody on a low dose of chemotherapy to see whether there is a significant benefit to individuals by doing that.
So in Focus4, we've got a specific trial for patients who are unselected by the testing we're doing in the lab. We call it Focus4 N for non-selected. In fact, there are three reasons why people might go into Focus4 N. One is because the tests don't really work properly, maybe because the sample was too tiny or something, it didn't work in the lab. That actually only occurs in about 2 in 100 patients, so that's a very unusual reason. But it's also available for people in a couple of more common situations. One is, as I've said, the trial can change, and there may be times when a particular trial for a particular subgroup of patients isn't active. And if that's the sort of cancer that you have, but the trial isn't active at the moment, then you can go into Focus4 N instead. Or the third reason is that maybe the particular trial for your particular subtype of cancer is only available in a big hospital a long way away from where you live, and you may not want to travel that far. So Focus4 N will be available in all of the trial centres, so you might choose it for that reason. So that's what happens.
So, Focus4 N is for people who have responded well to their chemotherapy and who are in any of the following 4 situations. 1. People whose laboratory tests for whatever reason could not be analysed completely, so the cancer cannot be classified into one of the specific molecular types. 2. Patients with a tumour type for which the trial treatment is very new and is therefore only available in certain specialist cancer centres. As some of these might be a long way from where you live, you might prefer to go into Focus4 N, which is being run in all the hospitals taking part in the trial. 3. Sometimes possible new treatments for your tumour type are not yet ready for testing in a molecular trial, in which case Focus4 N would be open to you. Finally, some patients who've done well after their chemotherapy may just prefer to be part of Focus4 N rather than any of the other molecular trials. If you do choose to be part of Focus4 N, then there are 2 possible groups with different treatment plans. Plan N1 is active monitoring, and Plan N2 is active monitoring plus capecitabine tablets. Allocation to either group is by randomisation, which was described in an earlier section on this DVD, and is the fairest way to test new ways of managing cancer. If you're randomised to active monitoring, you'll usually be seen in the clinic every 3 to 4 weeks to see how you're doing. You'll also have a CT scan every 8 or 9 weeks, which shows how the cancer's behaving. If there's evidence that the cancer's beginning to grow again, your oncologist will discuss any other options open to you. If you're randomised to treatment plan N2, you'll have the same active monitoring just described, plus capecitabine tablets, which are a well-known type of chemotherapy. If there's evidence that the cancer is beginning to grow again, the capecitabine treatment will be stopped, and again your doctor will discuss other options. Whilst you're in the study, you'll have a patient card to carry around at all times. In case of an emergency, the card informs people that you're in a clinical trial. If you receive the treatment plan with capecitabine, the patient card also lists the possible side effects that you could experience from the drug. On the back of the card are the details of the people you should contact if you feel unwell. It's important to stop taking the tablets if the side effects become troublesome and contact the research nurse or oncologist. There are also diary cards to complete, which are an important part of the study and will help you and the doctors keep track of what pills have been taken. Additionally, you'll be given questionnaires every 8 weeks that take no more than a couple of minutes to complete. These ask how you've been feeling in general. There's lots more detail about Focus4N in the patient information sheet, but you may like to ask your doctor or study nurses about other things before deciding whether or not to take part. And don't forget to write down any other questions you might have after watching this DVD.